Our other top story tonight, as of July 1st, state employees may no longer have their medical care covered at WVU Medicine Wheeling Hospital. That announcement was made this morning, and it comes after years of issues funding West Virginia public employees insurance. Thanks for joining us tonight for 7 News at 5. I'm Katherine Guyan. WVU Medicine says the hospital is not being properly reimbursed for treating patients with PEIA. With the state's legislative session only days away, the question is, how can West Virginia properly fund PEIA so more hospitals don't drop the coverage?
Nothing has changed with PEIA.
And that seems to be causing the problem.
Our budget hasn't kept pace with inflation. We haven't, spent money over what we've spent 5-6 years ago, and that's led to a lot of crises throughout the state, things like PEIA being underfunded.
While this issue will most likely be a major topic as part of the upcoming legislative session, State Senator Ryan Weld says it's not up to the legislature to just give the money to fund PEIA.
We do not have control over this health insurance program, nor do I think the legislature should be controlling a health insurance program.
Weld explained that the PEIA Finance Board works with the governor's office to determine how much money they request within the state's budget. That budget then goes to the legislature. Weld said what PEIA has requested has been approved in past years, but if they want more money, it needs to go in the budget.
We can't just give more money without an actual request being made, and so we have always followed by what the PEI Finance Board has put together.
This is not a new problem in West Virginia. Several years ago, the governor established a PEIA rainy day fund to cover the costs until there was a permanent solution to the funding problem. But there's still no answers to issues like reimbursement rates.
The governor put, I think, about $105 million into a fund for a one-time Band-Aid, right, that's allowed them to keep PEIA sustainable, but there's no permanent fix. So we're coming up to this cliff in the next 4 or 5 years where PEIA needs about another $376 million per year to be sustainable.
And those reimbursement rates are the issue here. WVU Health System said in a statement that PEIA pays more to out-of-state hospitals than those in the Mountain State, 475% more in 2021. With WVU Medicine Wheeling Hospital losing $56 million over the past 3 years, cutting PEIA patients helps financially.
We are a hospital in this area that has hospitals in other states very close by. And so when people can go to those hospitals as well, when those hospitals can receive a higher reimbursement rate from PEIA than hospitals in our very own state due to decisions that have been created by PEIA, I don't think anybody should be surprised by that, unfortunately.
WVU Health System also said in the same statement that this isn't a new issue. They took their concerns to PEIA before making a final decision, but they, quote, remain committed to working with PEIA to change how it reimburses West Virginia's hospitals, end quote.
This has historically been a problem for the legislature that is of the creation of others. And so it's, hey, you better give us more money right now, or our inability to make difficult decisions, our inability to manage this program is going to result in people not receiving health care.
You can read the full statement from WVU Medicine, WVU Health System at WTRF.com. In it, the healthcare provider outlined the exact difference in reimbursement for in-state versus out-of-state reimbursement.